Does the UK's National Health Service need reform? Yes, but no. As it stands, the number of people on NHS waiting lists has reached 7.42 million. The UK are second when it comes to doctors relocating and third when it comes to nurses relocating, with 129,682 domestically trained staff and 549,571 nurses leaving respectively. Since 2010, NHS staff have seen an 8% real terms pay cut, meaning since 2010, although statistics show NHS wages increasing nominally, when inflation, the rise in the costs of goods and services, is taken into consideration, they are worse off in actuality. The NHS is in crisis, but what is the solution? The current Labour Party, who are looking increasingly likely to win the next general election, is proposing a massive public service reform programme which includes changing how health, schooling, child and social care services operate. According to labourlist.org, a forum which provides insider news about the Labour Party, in the Labour Party's policy draft for the 2024 general election, West Streeting has argued for more private sector use, precisely utilising space in the independent sector to bring waiting lists down. Despite what politicians believe about increasing the integration and use of independent capacity within the NHS, studies have shown that this perhaps isn't an effective way to run such a massive public service. In an in-depth study in The Lancet, one of the most prestigious medical journals in the UK, two Oxford academics wrote a 9-page report on the impact of outsourcing in the NHS. We concluded three main things from their research. Outsourcing, the continued use of the private sector, has had direct links with excess preventable deaths. Independent providers, some of whom are not even medical institutions, have introduced ways to cut costs by reducing staff and assigning people to roles that they are not qualified to do for the sake of low costs and higher profits. The 2012 Health and Social Care Act, proposed by the coalition government, has swiftly aided the decline of the NHS. It has deepened competition, regulation and outsourcing. Firstly, we must know that around £11.5 billion worth of contracts were given to for-profit companies from 2013 to 2020, the dates investigated by the study. Where we have seen an introduction to the private sector, we've also seen a marginal increase in preventable deaths. What the private sector does is this. Preferential selection occurs, and this has been done since 2000. For-profit providers can increase pressure on the public sector by choosing which health cases to take on. Cutting costs also occur. After all, these are still businesses that need to create profits for their shareholders. This is done by cutting corners, reducing the number of staff being employed. Perhaps one may argue that efficiency is key to a fully functioning, cohesive healthcare system, which is indeed true, but what the private sector does in this instance is it employs less staff, with some staff not qualified to perform certain roles. If we take a look at the healthcare system since 2000, we can see that Tony Blair's government inherited a healthcare system that had followed a train of privatisation in the NHS. Blair did not end this, but he, unlike recent times, spent a high proportion of GDP on the NHS. Around 96 billion was spent until 2008. Waiting times fell during this period despite the use of the private sector, which we are strong opponents of. But this had long-lasting impacts and created an unaffordable, inefficient precedent for our current healthcare system. Blair's government used what was known as private finance initiatives in order to build 100 new hospitals that, in the end, the public didn't own. Around 60% of these hospitals had to close due to the inability to afford the repayments and the costs of loans. Think tank IPPR has found that PFIs, which initially costed us £13 billion, will end up costing NHS in excess of £80 billion until 2050, when the final contracts come to an end. The Blair administration was effective in bringing down waiting lists, and this is no surprise that this has a correlation to spending increases. However, what we can learn from his and past administrations is that privatisation is only a short-term fix. Long-term, it doesn't do the NHS any good. This was not improved under the following governments, especially the years of austerity exercised by the coalition government between the Tories and the Liberal Democrats. It doesn't build and improve on steady foundations. Accountability is an important play in politics. Private companies are only held accountable to their shareholders and not to the government. Current NHS staff have been on strike not only because of the erosion of their pay, but also because of poor working conditions. In an article written in The Guardian in 2006, senior NHS staff were convinced that the direction that the NHS was leading to would lead to an erosion of pay terms and conditions for staff. The incoming Labour government must build on the NHS capacities by investing in infrastructure and state-of-the-art facilities and restoring pay if they want to tackle the issue of brain drain. All of this must be done before the government thinks about increasing medical school places. There's no benefit in training youth doctors and nurses only for them to operate in severely underfunded and neglected institutions.